Hello and welcome to all of you. In this video, we will talk about the questions which are asked in our grand test regarding the pharmacology. So I am Dr. Saurabh Bhatia and I would be discussing these questions of pharmacology with you asked in grand test 4. Question number 1, prazosin is used under the following condition except. So answer is postural hypotension. Prazosin is a medicine. This medicine is an alpha-1 receptor blocker. Now, alpha-1 receptor is present on our blood vessels. So, whenever we block the alpha-1 receptor, the blood vessels get dilated. So, alpha-1 receptor present on blood vessels, and this will maintain the tone of the blood vessel. So, if I block the alpha-1 receptors, the blood vessels get dilated, and therefore, one of the important side effects of this medicine is hypotension. And this hypotension episodes will be more commonly seen whenever the patient will change his body posture. We call it postural hypotension and the orthostatic hypotension. So this side effect, that is postural hypotension, orthostatic hypotension, is a side effect of prazosin. It is never be given for the treatment of this postural hypotension. Rather, this medicine, which is a vasodilator, we can use this medicine for the treatment of hypertension crisis. Right? So postural hypotension, side effect of this medicine, this is the answer where the prazosin is not used. Now, in the patients of scorpion sting, patient can have the high blood pressure. I told you this medicine, which is a vasodilator, can be given to control this hypertension. This is given over there. And peripheral vascular disease, patient blood vessels get constricted. So, patient peripheral blood vessels get constricted. We also call it Raynaud's disease. So, one of the example of this disease is Raynaud's disease, and medicine can dilate the blood vessel. Now, there is one more location of alpha-1 receptor. This receptor is present on the prostate gland. So when I block the alpha-1 receptor, the prostate gets relaxed and patient is able to pass the urine. So patients who suffer from benign prostate hyperplasia, we can block the alpha-1 receptor, and by this way we can relax the prostate gland, and now the patient is able to pass urine. So theoretically, yes, medicine can be given for BPH treatment. So question number 1, answer is 4. Question number 2, a 14-year-old boy brought to the emergency department. While in the school, he injected his friend's EpiPen. So EpiPen is epinephrine. So EpiPen is epinephrine. So epinephrine was injected into the palm of his left hand. So one of his friend injected EpiPen in the palm of his left hand. Now shortly afterwards, the left middle finger become cold and pale. So patient hand, the fingers will become cold and pale, and the refill time of the capillaries was 5 to 6 seconds, which is very, very less, which is very, very long time. What is the most appropriate management? So guys, we know that epinephrine, the medicine name is adrenaline, also known as epinephrine. Now this medicine can act on all alpha and all beta receptor. So this can act on all type of alpha, all type of beta receptor. Now one of the alpha receptor is alpha-1. So by acting on alpha-1 receptor, this medicine can cause vasoconstriction. So we know that alpha-1 receptor present on blood vessel. So epinephrine, by acting on alpha-1 receptor, can cause vasoconstriction. As a result of that, the structures which are supplied by end arteries, like the fingers are supplied by end arteries, so those blood vessels get constricted, and that will lead to gangrene or the ischemia of those parts of the body which are supplied by end arteries. So patient is getting ischemia of the fingers. That's why his fingers are getting cold and pale, because the blood supply get interrupted due to the massive vasoconstriction caused by the epinephrine. So what is the antidote that we have to give? So here we have to give an alpha blocker. So alpha-1 has caused the problem. We have to give one alpha blocker. So phentolamine. So phentolamine is a medicine which is a non-selective alpha blocker. This is a blocker of both alpha-1, alpha-2 receptor. So this medicine can be used as a medicine. This medicine can be used as a medicine for the treatment of this vasospasm caused by the infiltration of the epinephrine to the surrounding tissue, or the extravasation of the epinephrine to the surrounding tissue that will cause vasoconstriction. So answer is D, Delhi, phentolamine can be given. Now histamine is a medicine. Histamine actually is not a medicine. Histamine is a chemical compound. If I inject this histamine at this place, histamine, although it can cause vasodilation, but histamine is not a very strong vasodilator. Histamine is not the strong vasodilator which can dilate the blood vessels caused by the epinephrine. Epinephrine is a massive vasoconstrictor. It cannot be dilated by the histamine because histamine acts on H1 receptor and can contribute in vasodilation, but the epinephrine has caused vasospasm due to the alpha-1. So here we have to block the alpha-1 at any cost. By stimulating the other pathway, we cannot achieve that much of vasodilation. Intravenous nitrate infusion. So intravenous nitrate infusion, if we do, that medicine first of all get dissolved in the plasma, and that will take long time to dilate the blood vessels. Although this will take care of it, but it will take long time. Until that time, maybe there is a possibility that there is a permanent damage to the patient's fingers that can take place. Inhalation of the nitric oxide, that is also be a possibility, but again the same thing. This is patient will consume this. This is a kind of a anesthetic agent, and once this anesthetic agent will enter in your plasma, then this will cause effect in the body, but that will take very long time, and before that the patient will have the other symptoms which are related to the general anesthesia drugs, and that is something not required here. If you can treat a patient by giving a local alpha-1 blocker, why to give medicines by inhalational route like nitrogen plus oxygen combination? So question number 2, answer is D, Delhi. Question number 3, which of the following is a GQ type of receptor? So here the answer is the alpha-1 receptor. So alpha-1 receptor is a GQ type of receptor. So guys, please remember this question is based on G protein coupled receptor. This is the most common receptor of human body. We call it G protein coupled receptor. This is a 7 helical structure. So this receptor has a 7 helical structure. So like a shape of a snake. And we know that in Sanskrit the snake is known as serpent, right? We call it serp. So it's a serpentine shape. The snake is known as serp, we call it serpentine shape, 7 helical shape, where we have the presence of this G protein. Now this G protein which is present over here, this G protein is mainly present in GDP form. So GDP form is the inactive form of the receptor, and whenever the drug will come and bind to the receptor, this protein will become GTP, which is the active form of the receptor. So GDP is the inactive form, GTP is the active form of the receptor. Now when this receptor get activated, when this receptor which is a G protein coupled receptor which was previously GDP now become the GTP. Now when this becomes GTP, there is a alpha unit, we call it G alpha unit. This is now released. This is now released from the receptor. Now this G alpha can be of 3 types. This can be G alpha S stimulatory type. This can be G alpha I inhibitory type. This can be G alpha Q or not. Now, if it is G alpha S, this will increase the level of cyclic AMP in the body and can result in stimulatory action. Now, G alpha I will decrease the level of cyclic AMP and can result in inhibitory action in the body. Now, G alpha Q is the one that will increase the level of chemical compounds like IP3 and DAG. This will increase the chemical compound, that is IP3, that is inositol triphosphate and diacylglycerol, and this will result in action in the body. So one of the example of G alpha Q type, they are asking which receptor is G alpha Q type. So answer is alpha 1. So alpha 1 receptor belong to this class. So alpha 1 receptor, muscarinic 1 receptor, muscarinic 3 receptor, muscarinic 5 receptor. So muscarinic 1, 3 and 5 and alpha 1 receptor are the examples of G alpha Q. G alpha I receptor example is alpha 2 receptor, muscarinic 2 and muscarinic 4 receptor. Muscarinic 2, muscarinic 4 receptor and alpha 2 receptor are inhibitory type of receptor, and this is beta receptors. All type of beta receptor, beta 1, beta 2, beta 3, they are the stimulatory type of receptor. So we have discussed the examples of various receptors, G alpha S, G alpha I, G alpha Q. So they are asking which receptor is G alpha Q, that is alpha 1. Now dopamine receptor. So we have 2 types of dopamine receptor, D1 and D2. Now D1 receptor act by cyclic AMP, so it's a G alpha S. This is G alpha S. Now D2 receptor act by decreasing the cyclic AMP, so this is G alpha I. So this is G alpha I. So G alpha S, G alpha I are 2 things. So question number 3, answer is C alpha 1. Question number 4, a 45-year-old chronic smoker wanted to quit smoking. After counseling of a doctor, decided to start on drugs with family support and through proper counseling. The drug is a partial agonist of alpha 4 beta 2 nicotine receptor. So guys, this is the receptor which is involved in nicotine addiction. So this is a receptor present in the brain involved in nicotine addiction. So we have to give medicines that will act on this receptor. So you can find out from the here, the name says the drug name is varenicline. You can find the medicine is having the word nicotine in its name. So this medicine will bring the patient back on the line, right? So this is nicotine medicine, or varenicline is a drug that will act on nicotine N receptor alpha 4 beta 2 type. Now this medicine is given in a form of monotherapy, and we give this medicine by oral route. So we give the monotherapy of the drug given by oral route. It's a fixed course of 12 weeks we give to the patient to make the patient de-addicted. Now this varenicline is used in a patient who are not motivated enough. We are not much motivated enough to quit the smoking. So in this question, although there is no other possibility of answer, that's why we marked varenicline. But for this kind of patient who is fully motivated, you can see from here, the patient is motivated. Patient is fully motivated to quit the smoking after counseling. And family support is also there. So the chances of getting successful is very high. So here in this kind of patients who are motivated enough to give up the habit, we give the nicotine in the form of skin patch. So nicotine skin patch is a preferred therapy for the motivated patients, but the patients who are not motivated enough, we give varenicline. So two medicines are there, varenicline for unmotivated patients, nicotine for motivated patient. The third medicine that we use for nicotine de-addiction is a bupropion. So there are total 3 medicines we have for nicotine de-addiction. Nicotine skin patch for the patients who want to give up the habit, varenicline who are not motivated enough, and bupropion is a third medicine which is less commonly used. Just for the sake of completion, I have covered the medicine name over here. Now let's talk about question number 5. Now question number 5, which drug is FDA approved drug for the treatment of breast cancer which is ER positive or estrogen receptor positive? So we have a medicine, the drug name is tamoxifen. So this medicine, you can see from its name, the medicine name is tamoxifen. Now this medicine is a one that is SERM. So this is an SERM medicine. We call it selective estrogen receptor modulator. So this is selective estrogen receptor modulator, and this medicine can inhibit the estrogen receptor in the breast tissue. And if the breast cancer is growing due to the effect of estrogen, this medicine can stop the growth of this breast cancer. So medicine has got approval for breast cancer. Now, this medicine can lead to some important side effect. For example, this medicine can lead to cancer of endometrium. So one of the important side effect of medicine is this medicine can cause cancer of endometrium. This medicine can result in cataract as a side effect. This medicine can cause coagulation problem. Medicine can result in coagulation problem and can result in cold and hot flashes. This medicine can cause cold and hot temperature intolerance. So medicine can cause 4 side effects. All side effects start with C. Medicine can cause cancer of endometrium, cataract can be there, coagulation problem can be there, and cold and hot intolerance can be there. If we talk about the other medicines, you can see from here, the medicine is having the word MO. So this is given for memory gland problem. This medicine is given for memory gland problem. Now raloxifene is having the medicine, having the word LO. So this is given for locomotion problem. So this medicine is given for locomotion problem, means the body movement problem. So this medicine has got approval for osteoporosis. So post-menopausal osteoporosis, raloxifene is got approval. So in osteoporosis, patient will have the problem of locomotion. We can use the raloxifene as one of the drug for the treatment of that. Now you can see the one more drug here, clomiphene. All these are basically SCRM. So clomiphene starts with the word CLO. So this medicine is given to make the clones. Basically what will happen when this medicine is given to female, female will have ovulation, and when the female will have ovulation, she can conceive. So this medicine is given for the treatment of infertility. So this medicine is given for the treatment of infertility, where the medicine can result in ovulation and patient can conceive. So we can remember like this way, if you really want to have clones in your family, you want that somebody looks like you should be there in your family, take clomiphene. This will give you lot of clones, because the medicine side effect is multiple ovulation. Not the single ova will come out, multiple ova will come out, and you can have the multiple kids together. So question number 5, answer is B Bombay, tamoxifen is the answer. Question number 6, based on antibiotics. So we see that the medicine name is streptomycin. So streptomycin and other aminoglycosides inhibit bacterial protein synthesis by binding to which of the ribosome? So answer is the medicine will act on 30S ribosome. Medicine will act on 30S ribosome, and where this medicine will inhibit the messenger RNA reading. So there the medicine will bind to 30S ribosome, and inhibit the messenger RNA reading. So this is also correct. So overall answer is D, Delhi. So both A and C can be the correct option. So both A and C can be the correct option. So streptomycin, another aminoglycoside, inhibit bacterial protein synthesis by binding to which of the following? Answer is 30S ribosome, where the medicine will inhibit the messenger RNA reading. Right? So guys, please remember, if we talk about the medicines which are protein synthesis inhibitor, now some of the medicines will bind to 30S ribosome, some of the medicines will bind to 50S ribosome. So the medicines that will bind to 30S ribosome, medicines are aminoglycosides, right? And aminoglycosides typically inhibit the messenger RNA reading as well as inhibit the ribosomal RNA chain formation. Now the second group of medicines that will act on 30S ribosome, medicine name is tetracyclines. Now tetracyclines are inhibitor of transfer RNA. Tetracycline starts with T, inhibitor of transfer RNA. Aminoglycosides, inhibitor of messenger RNA and ribosomal RNA. Now we have some medicines that will act on 50S ribosome. So the medicines which will act on 50S ribosome, medicines names are streptogramins. Medicines are streptogramins. Medicines are macrolides. In macrolides, we have a classical example of a drug, erythromycin. So erythromycin is a macrolide. We have a medicine like lincosamides. So in lincosamides, we have one drug that is clindamycin. So clindamycin is a medicine which is a lincosamide. Then we have a medicine like linezolid. And finally, we have a medicine that is chloramphenicol. So we have 5 medicines that will act on 50S ribosome. 5 medicines will act on 50S ribosome like streptogramins, macrolides, lincosamides, linezolid, chloramphenicol. And we have 2 medicines which will act on 30S ribosome. Students usually make the mnemonic like this way: by at 30. By at 30, cells at 50. So by at 30, cells at 50. So aminoglycosides, tetracyclines. Aminoglycosides, tetracyclines will act on 30S ribosome. Streptogramins, erythromycin, lincosamides, linezolid, chloramphenicol. They will act on 50S ribosome. Right? So question number 6, answer is D, Delhi. So we have discussed the medicines that will act on various types of ribosomes, and medicines are protein synthesis inhibitor. Question number 7, 32-year-old woman was hospitalized and catheterized with a catheter, obviously Foley catheter. Now she developed a UTI, and because she was admitted and in hospital she has got UTI, it means it's a hospital acquired infection, catheter induced UTI. It's quite commonly Pseudomonas. Pseudomonas is a bacteria, problematic bacteria seen in hospital acquired infection. Now, which of the following is not effective in the treatment of the infection? So here, as a PG aspirant, you should be knowing which medicines are useful for Pseudomonas. So medicines which are useful for Pseudomonas, number 1, we have beta-lactam antibiotics. So we have beta-lactam antibiotics which we use for Pseudomonas. In beta-lactam antibiotics, we have some penicillins which are given for Pseudomonas. Examples are like piptaz. So piptaz is a penicillin that we use for Pseudomonas. We can use the medicine like carbencillin. We can also use the medicine like ticarcillin. Right? So carbencillin, ticarcillin are the penicillins which are useful for Pseudomonas. We also have some cephalosporins. We have some cephalosporins which are useful for Pseudomonas. Medicines are cefoperazone. So we have the medicines like cefoperazone. We have a drug like ceftazidime. So we have a medicine like ceftazidime, cefoperazone. These are the generation 3 cephalosporins. These 2 medicines are useful. And all the medicines of generation 4 like cefepime, cefepirome. There are only 2 medicines which come under this generation 4. So generation 4 medicines, generation 3 medicines. Cefepime, cefepirome, cefoperazone, ceftazidime. These are the 4 cephalosporins useful against Pseudomonas. Now guys, please remember carbapenims. Almost all carbapenims are useful against Pseudomonas, and we have the monobactams. We have the monobactams, and only one drug is there in the monobactam, azithromycin. So these medicines are useful against Pseudomonas. So beta-lactams are given for the treatment of Pseudomonas. This is what we people have discussed. Now second group of medicines which are given for Pseudomonas, we have aminoglycosides. So aminoglycosides also given for Pseudomonas. So which aminoglycosides have got approval for Pseudomonas? Medicines names are tobramycin, medicine name is amikacin, and we have a drug gentamicin. So we have a medicine gentamicin, amikacin, tobramycin. So tobramycin, amikacin, gentamicin, these are the aminoglycosides given for Pseudomonas. Number 3, we can also use fluoroquinolone. So which fluoroquinolone? Answer is ciprofloxacin, and we have a medicine colistin. So these are the total 4 group of medicines that you should be knowing for your exam. The medicines which are useful for Pseudomonas: beta-lactams, aminoglycosides, fluoroquinolones, and colistin. Now things are very easy for you. You can find out the answer. What is the answer here? Answer is vancomycin. So vancomycin is not given for Pseudomonas. Rather, vancomycin is considered as drug of choice for MRSA, that is methicillin resistant Staph aureus. So vancomycin is drug of choice for MRSA. Now question number 8. Which of the following fluoroquinolone has the maximum oral bioavailability? So this topic is based on fluoroquinolone pharmacokinetics. So there are 2 fluoroquinolones which have almost 100% oral bioavailability: levofloxacin and ofloxacin. So levofloxacin, ofloxacin, they have almost 100% of oral bioavailability. Medicines are levoflox and oflox. So these medicines have maximum oral bioavailability. The answer is C. Now if we talk about the other pharmacokinetic properties of this medicine, guys, please remember fluoroquinolones are the medicines. Among these medicines, ciprofloxacin is a drug which is a liver enzyme inhibitor. So this medicine is a medicine. This medicine is a fluoroquinolone which is a liver enzyme inhibitor. Now whenever we give fluoroquinolone along with NSAIDs, or along with theophylline, along with NSAIDs, these medicines can have high risk of seizures. So these medicines can result in seizures as a side effect when you combine these medicines with NSAIDs and theophylline. Right. Number 3 property, these fluoroquinolones should not be given to pregnant females. Fluoroquinolones should not be given to pregnant female. Otherwise, these medicines can interfere with the tendons and cartilage. So they can interfere with the tendons and cartilage of the baby or the fetus, and this tendon and cartilage growth will be impaired when given to pregnant female. Right. So these are the medicines these are 3 important pharmacokinetic aspects of these medicines. Now other aspects like moxifloxacin. So like moxifloxacin is one of the medicine. One more is levofloxacin. Now these 2 medicines have got approval for tuberculosis. So these medicines have got approval for tuberculosis. Now moxifloxacin is a drug which is purely metabolized by liver. This medicine is purely metabolized by liver. So this medicine is safe to use in patients of CKD. So this medicine is purely metabolized by liver. It is safe to use in patients of CKD. Now getifloxacin is an outdated medicine. And why this fluoroquinolone is outdated? Because of the important side effect as hypoglycemia. So this medicine can cause hypoglycemia as a side effect. That's why this medicine is outdated. And ciprofloxacin, we have discussed already. Now ciprofloxacin, when given to a patient, this medicine is considered as drug of choice for Shigella, and it is also a drug of choice for Bacillus anthracis. So this is a drug of choice for Bacillus anthracis and drug of choice for Shigella. Drug name is ciprofloxacin. So question number 8, answer is C. Let's move on to question number 9. 40-year-old male, known case of TB, diagnosed 4 months back, and he's taking anti-tubercular treatment. He's taking AKT. AKT is a brand name of anti-tubercular therapy. Now recently diagnosed with gout. The patient has got gout. Which of the following anti-gout drug is known to have maximum interaction with anti-tubercular drugs? So guys, answer is allopurinol. Now allopurinol is a medicine. This medicine is a liver enzyme inhibitor. So this medicine is a liver enzyme inhibitor, and this medicine can inhibit the metabolism of TB drugs. So this can inhibit the metabolism of TB drugs. So allopurinol is a medicine which has this maximum drug interaction among TB drugs. If we talk about allopurinol, although allopurinol is a medicine, it's a drug of choice for gout. And what is the mechanism of action of allopurinol? Allopurinol is a medicine which is a xanthine oxidase inhibitor. So this medicine is a xanthine oxidase inhibitor. Now this medicine can form a metabolite. The name of the metabolite of allopurinol is oxypurinol. So oxypurinol is a metabolite of allopurinol which is also active, and this is a type of pseudo irreversible blocker. This is a pseudo-irreversible blocker of xanthine oxidase. So this is pseudo-irreversible blocker of xanthine oxidase enzyme. Drug name is allopurinol. Its metabolite is pseudo-irreversible blocker of xanthine oxidase. Allopurinol itself is a reversible competitive blocker. So it itself is reversible competitive blocker of xanthine oxidase, but its metabolite is pseudo-irreversible blocker of this xanthine oxidase. Now here we have a drug colchicine. Now colchicine is an anti-inflammatory medicine. And how this medicine will act as anti-inflammatory? This medicine can inhibit the WBC multiplication in the lymph node, and this medicine can also stop the WBC migration. This can also stop the WBC multiplication as well as the WBC migration at the site of inflammation. Drug name is colchicine. Now probenecid is a medicine which is a uricose uric drug. This medicine is a uricose uric drug. It means this medicine can increase the elimination of uric acid. So this medicine can increase the elimination of uric acid from the body. It's a uricose uric medicine. Now resp uricase is an artificial uricase enzyme. This will start the metabolism of uric acid. This will result in increased metabolism of uric acid. So allopurinol is overall the drug of choice for gout. It is a xanthine oxidase inhibitor and hence inhibit the uric acid synthesis. So this is uric acid synthesis inhibitor, but the resp uricase is medicine that will induce the metabolism of uric acid. So question number 9, answer is A. Question number 10, which of the following anti-rheumatic drug acts by increasing extracellular adenosine? The answer is methotrexate. So methotrexate is a drug of choice for rheumatoid arthritis. It's a best disease modifying anti-rheumatoid drug. Best disease modifying anti-rheumatoid drug to be used clinically, and this medicine has two mechanisms of action. This is inhibitor of dihydrofolate reductase enzyme. So this can inhibit dihydrofolate reductase enzyme, and this can also inhibit. So this can inhibit dihydrofolate reductase enzyme, and this can also increase the level of adenosine in the plasma. So by inhibiting dihydrofolate reductase, this can stop the WBC multiplication, and the medicine has immunosuppressant property. But because of adenosine, this medicine has anti-inflammatory property. Because of this reason, this medicine has anti-inflammatory property. Drug name is methotrexate. Now, one of the important side effects of methotrexate is bone marrow suppression. This medicine can also cause liver and the pulmonary fibrosis. So medicine can cause fibrosis of lungs and kidney, plus this medicine can cause bone marrow suppression, which we can prevent. By giving folic acid along with this medicine. In case folic acid is not given, you can also give the active form of folic acid, folinic acid. So folic acid, folinic acid given along with methotrexate to prevent its side effects. Now we have a drug over here, the hydroxychloroquine. This is also used as a DMARD. Now one of the important side effects of hydroxychloroquine is bullseye retinopathy. So this medicine can affect the central part of the retina, which is a bullseye retinopathy. So bullseye retinopathy, side effect of hydroxychloroquine. So these two medicines we have discussed in this MCQ. Leflunomide is one more DMARD that we can use. Azathioprine is one more drug that we can use. So question number 10, answer is C. Methotrexate is the answer. Question number 11, 62-year-old female came to the OPD with history of chronic fever, body ache, minimal weight loss. She is diagnosed with HIV infection because the symptoms will tell you about HIV. The doctor prescribed enfuvertide medicine. The drug belongs to which class? So guys, it's very easy. The medicine has the word VIR. It's an antiviral drug. Medicine is also having the word FU. FU means fusion inhibitor. So this medicine is virus fusion inhibitor. So this is an entry inhibitor, fusion inhibitor. Answer is C. Right? So guys, please remember, whenever the virus has to take entry in WBC. So this is the HIV virus. Whenever this virus has to take entry in WBC, with the help of glycoprotein 41, the membrane of the virus will fuse with the WBC membrane and take entry in the WBC. So we have the medicine which is glycoprotein 41 inhibitor. So enfuvertide is a glycoprotein 41 inhibitor and can inhibit the fusion of the virus membrane with a WBC membrane. So stop the virus entry in the WBC. Now we have other medicines that we use for HIV. For example, we have the medicines protease inhibitors. So any medicine that ends with the word Navir, Any medicine that ends with the word navir, one example is like ritonavir. So one of the example is like ritonavir. One more example is like etazanavir. So all medicines that ends with the word navir are protease inhibitor. Now we have a more class of medicines which are given for HIV. We call them integrase inhibitor. Now all these medicines end with the word tigravir. So all the medicines end with the word tigravir. Integrase inhibitor, they have the word tigravir. Vir means virus, tigre means integrase inhibitor. So one of the example of the medicine is dolutegravir. So dolutegravir, reltegravir, elvitegravir, all these medicines are integrase inhibitor. Now we have a drug which is CCR5 receptor inhibitor. Now just remember, it's a unique name of the medicine. The drug name is Maraviroc. So Maraviroc is one more drug which is CCR5 receptor inhibitor, and this will also stop the virus entry. Now apart from that, guys, we have medicines which are known as NRTI. Now all the medicines which are NRTI, they end with the word vodine. So NRTIs are the medicines, they end with the word vodine. But apart from vodine, we have a different drug here, that is tenofovir. So tenofovir plus all the medicines which have the word vodine, like zidovudine, lamivudine, these are the NRTIs. Now we have the medicines which are NNRTIs. Now NNRTIs are the medicines, all the medicines end with the word virin. All the medicines end with the word virin, plus we have one more drug, nevirapine. So nevirapine is a different name. The rest of the medicines have the word virin in their name. Like we have the medicines rilpivirine, efavirin. So efavirins, rilpivirine, all these medicines are there. Plus we have a different name, nevirapine. These medicines are NNRTI. So we have a NRTI, nucleoside reverse transcriptase inhibitor, and we have a non-nucleoside reverse transcriptase inhibitor. So one group, second group. Third group is integrase inhibitor, tigravir. Fourth group is protease inhibitor, that is navir. Fifth group is fusion inhibitor, that is enfuvirtide. Sixth group is CCR5 inhibitor, like Maraviroc. So all these medicines we use for the treatment of HIV. So question number 11, answer is C. Let's move on to question number 12. Now visual acuity and loss of red-green discrimination are seen with which anti-tubercular drug? So the answer is ethambutol. So ethambutol is a medicine that can lead to two important side effects. So this medicine can cause red-green color blindness. We also call it optic neuritis. So when this side effect will appear, you have to stop the medicine permanently. You cannot continue the medicine, otherwise this will cause permanent vision loss. Second side effect of the medicine is hyperuricemia. Now when this medicine will cause hyperuricemia, if this hyperuricemia is asymptomatic, if it is not causing any problem, then no treatment is advisable. So no treatment is advisable. But if it is symptomatic, if this is symptomatic and can cause problem to the patient, we can give NSAIDs to a patient, we can give painkiller to a patient, because once we stop the treatment, this will automatically reverse. So give painkiller. In case painkillers will not work, you can also give allopurinol. So you can also give allopurinol to the patient. Now, isoniazid is a medicine. This medicine can cause three important side effects. One is liver toxicity. Second is vitamin B6 deficiency. As a result of vitamin B6 deficiency, this medicine can result in neuropathy as a side effect. So this medicine can cause neuropathy. This medicine can also result in seizures as a side effect because of vitamin B6 deficiency. Third side effect is this medicine can result in SCD-like symptoms. This medicine can result in SCD-like symptoms as a side effect. If we talk about side effects of rifampicin, so rifampicin can also lead to some important side effects, like this medicine can cause orange discoloration of the body secretion. This medicine can also cause flu-like symptoms. Medicine can cause common cold symptoms, flu-like symptoms, orange discoloration. This will also cause liver toxicity like the isoniazid, and the very important side effect is bone marrow suppression. And because of bone marrow suppression, the medicine side effect is hypersensitivity reaction. Please make a correction here. Medicine side effect is hypersensitivity reaction. As a result of hypersensitivity reaction, this medicine can suppress the bone marrow. So medicine can suppress the bone marrow, can reduce the WBC count, can reduce the platelet count, and medicine can result in pancytopenia as a side effect. It's the most serious side effect of the rifampicin, hypersensitivity reaction. Next is cycloserine. Cycloserine is a medicine which can cause CNS toxicity. So this medicine can cause CNS toxicity like the seizures and psychosis. So this will cause seizures and psychosis as a side effect. Cycloserine side effect is CNS toxicity. So question number 12, answer is C, ethambutol. Question number 13. A bank employee who felt depressed and having no interest in day-to-day activities came to the AIMS OPD, started on escitalopram. So guys, we know that depression, the drug of choice SSRI. So SSRI is selective serotonin reuptake inhibitor. They are the best medicines for depression. Now, which is not a side effect of escitalopram. So if we talk about side effects of SSRIs, you can remember with the mnemonic, that is go SSRIs. So the most common side effect of the medicine is GAT side effect. Most common side effect, GAT side effect, and this will cause nausea, vomiting and diarrhea. So nausea, vomiting, diarrhea, GAT side effects, most common side effect. Now O stands for osteoporosis. O stands for osteoporosis. S stands for serotonin syndrome. S stands for serotonin syndrome, where the patient blood pressure will increase, patient heart rate will increase, patient can also have the tachypnea. This is known as serotonin syndrome. And for the same reason, we should not combine SSRIs with linezolid. This was the question asked this time in your NEET exam. So this time in dental NEET exam, they have asked this question, that female is taking antidepressant and she has been given some antibiotic and she has got high BP, high heart rate. So which drug is given? Answer was linezolid. So this is avoided with linezolid, avoided with tramadol, avoided with pethidine, because these are the other medicines which can cause serotonin syndrome. So avoided with linezolid, tramadol, pethidine. So this is the medicine that is avoided with linezolid, tramadol, pethidine, because the medicines can cause serotonin syndrome. Now the fourth side effect of the medicine. Now these medicines can cause sexual dysfunction. So these medicines can cause sexual dysfunction as a second most common side effect. So most common side effect, GAT side effect. Second most common side effect, sexual dysfunction. And in sexual dysfunction, this medicine can cause absence of orgasm, delayed orgasm or absence of orgasm, and patient can develop anorgasmia. So patient will not achieve orgasm, patient get involved in the sexual activity, but still will not achieve the peak, will not achieve the orgasm. We call it anorgasmia. Now, one more side effect of the medicine is, these medicines can cause recurrence of symptoms. Can cause recurrence of symptoms on discontinuation of the drug. So when you stop the medicine, there are some medicines, when you stop them, there is a risk of recurrence of symptom. So recurrence of symptoms can occur on discontinuation of the medicine. This is typically seen with paroxetine and fluvoxamine. So this problem is typically seen with fluvoxamine and paroxetine, two medicines, two SSRIs which have the problem of recurrence of symptoms on discontinuation. And the last side effect of the medicine is insomnia and vivid dreams. So these medicines can interfere with your sleep, can result in vivid dreams, abnormal dreams and insomnia. So insomnia, vivid dreams are the side effects. So medicine's mnemonic is go SSRIs, where the G stands for GAT toxicity, O stands for osteoporosis, S stands for serotonin syndrome, S stands for sexual dysfunction, R stands for recurrence of symptoms on discontinuation like paroxetine, fluvoxamine, and I stands for insomnia. So here the side effect is cialuria, which is not seen with this medicine. The rest of the side effects are seen. Now cialuria is a side effect of an antipsychotic medicine, clozapine. So clozapine is an antipsychotic medicine. This will cause cialuria as a side effect. So clozapine side effect is cialuria, and one more important side effect of clozapine is agranulocytosis. So one more side effect of clozapine is agranulocytosis. So one is cialuria, one is agranulocytosis. So question number 13, answer is A. Question number 14, a surgeon has applied a field block with lignocaine and performing appendectomy. The blockade of fibers will occur in the following order. So this is what you have to just mug up. So first of all, type B fibers. So type B fibers are first of all get affected, then type C fibers, then alpha, A delta, A gamma, A beta, A alpha. Right? So they get affected in the same sequence like we have discussed, type B, C and then A. Right? So this is just, you have to mug up like how these fibers get blocked whenever we give the local anesthetic drugs. So this is all about the 14 questions that are asked in your GT exam. So guys, after that, if you have any query, we are there with you. So we are there with you on the Telegram group. In case you have any query, you can tag me as a Dr. Saurabh Bhatia. So I will be happy to help you on all your queries, and I will be there with you till the time you will not clear your exam. All the best guys. Keep studying hard. We'll meet again. Thanks for watching this video.